Welcome to the February 2026 child safety topic. This month, we are discussing winter blues, seasonal affect disorder, and suicide awareness, all important topics to consider in these winter months. So it's important that as we talk about these terms that we do some defining of what they are, what they mean, because in some spaces we might hear these words used interchangeably. So a lot of folks find themselves feeling sad with the shorter daylight hours and the cold, dark days and things like that. And so if someone feels like it's really impacting their motivation to get out of bed, their feelings of happiness, things like that. That's something to keep in mind. Winter blues do kind of come and go. You kind of feel down in the dumps, about all the snow, the cold weather, things like that. But that's very different from seasonal affect disorder. People with seasonal affect disorder may feel anxious or irritated for prolonged periods. Those are often much more noted in the winter months. And sometimes we might find there's withdrawal from social situations, and it definitely has its impact on mental acuity and things like that. It is a major depressive disorder, which really does need to be treated and supported by a medical provider. And it usually lasts, if it does last, especially if it does last for longer than a few weeks. Whereas winter blues, they're milder, and there might be some sadness and irritability, lack of energy and things like that. But the primary cause is, of both of these is attributed to the lower level of natural light we are exposed to in the fall and winter months. So this is a great Venn diagram that really lets us view the differences between winter blues and seasonal affect disorder. There are some shared things for us to consider. Low energy, lack of motivation. It can sometimes impact sleep. But you'll see that these are have different key elements. So one of the things we want to be mindful of and that we're going to be talking a little bit more about today is that last bullet point there on the seasonal affective disorders side, which is may have suicidal thoughts. So we're going to definitely be diving into some prevention strategies around that and just some awareness building. So we're going to watch a video if it hopefully plays, but this video is a quick little overview of beating those seasonal depression and winter blues from Dr. Sue Varma, a psychiatrist. So I am going to play that for us if it will play. Yes.
In our morning rounds, we're taking a closer look at a potentially negative outcome of the end of daylight saving time, seasonal depression. Nearly all of us wound our clocks back yesterday. When we fall back, the sun rises and sets an hour earlier. That can disrupt our natural rhythm and cause the winter blues, or the more severe seasonal affective disorder. Psychiatrist Dr. Sue Varma is here with how to avoid the possible impact. Good morning, Sue.
Good morning.
How does a 1 hour swing, just a 1 hour swing, have such a significant effect on our moods?
So our body clock, our circadian rhythm, relies upon two important things, routine and light. And even a 15-minute change in our bedtime or wake time causes a major disruption. And what we're finding is it's not just this one day, right? We think that magically we wake up and we have an extra hour, but the shorter daylight hours leading up to it is particularly difficult for people who are prone to seasonal blues or affective disorder.
And this is something that affects women more than men, potentially seasonal affective disorder?
Yes, and if you can believe it, 4 times as many women are affected than men.
Wow.
Wow.
And it's
Why would
not
that be?
entirely, it's not
Yes,
entirely clear, but we think that women are more sensitive because of hormonal fluctuations, to depression in general, but particularly to the lower daylight hour. What we're finding is serotonin is lower. Serotonin is really important to maintain our mood, to decrease our irritability. Serotonin is noted with carbohydrate changes. People get more carb craving. They want to sleep more. They want to eat more. And the opposite is happening in the springtime.
How do you know that it might not be depression and just plain old wintertime blues? What's the difference between the two?
Yeah. So 5% of the population, depending on what part of the country or what part of the world you live in, will be affected by seasonal affective disorder. And this causes impairment in our functioning. So the person is actually missing appointments. They're not able to get to things. They are avoiding people. They're procrastinating. And this has an impact on their job and their relationships. They're drinking more. They're fighting more with their family members. But the blues, which 15 to 20% of people might have, and it often flies under the radar, unfortunately, is more of the hibernation, where you're like, I don't feel like it, but you're able to get the stuff done.
What do you do to keep the blues or even depression at bay?
Yes. So the first thing is start early, I say. People often who have seasonal blues get it year after year starting in fall. So light boxes are a very common thing, but do that under the care of a professional. Exposure to daylight in the early morning hours between 7 and 10 a.m. If you can get 20 minutes outside, that's really important, because what it does is it shuts the melatonin off. We think of sleep and sleep hygiene as something you only do at bedtime. No, you have to start in the morning. Physical activity is really important, social support, limiting caffeine after 4 p.m., and exercising every day is really important.
All right, so settle a debate online from a medical perspective.
Yes.
Daylight saving, should it be done away with?
You know, daylight savings is great in the sense that it gives us more sunlight, and that is really important to keep away sedentary lifestyle.
Except it's dark at 4.
Yeah.
Yes.
I do
No,
hate
that
that
is
part of it.
depressing.
Yeah.
We need
But
the
go
longer
ahead.
daylight hours,
Yeah.
because even childhood obesity is linked to when we have shorter daylight. So we really do need exposure to daytime to get people out, to get them motivated, exercising, connected, not hibernating.
All right, so maybe medicine.
All right. So some important great tips she shared there, right? So let's take another deeper look at seasonal affect disorder. So it can be easy to pass off seasonal affect disorder as insignificant, especially if we're conflating that with just simply saying the winter blues. Winter blues are somewhat common. But if we notice that it's really having an impact on our day-to-day functioning and well-being, we want to make sure folks are doing those tips she shared in the previous video, making sure they're limiting, their screen time at bedtime, getting that good sleep, making sure they're doing those things that'll really impact their overall wellness, staying connected to others, thinking about those positive aspects of well-being. It does show that females are at higher risk than males of developing this disorder based on various research that's been done. So just to kind of recap some of the signs of seasonal affect disorder, if someone's sleeping too much, if they seem to have an extreme amount of mental and physical fatigue, if there is a loss of interest in the things that usually bring someone joy or they enjoy doing, if they're having a sense of hopelessness, if they're dealing with thoughts of suicide, that's a big one. We want to be mindful of that. As she shared in the video, light therapy can really help. It really does do wonders for our brain to be around. There's called specific lights that you can buy to help with winter blues and or seasonal affect disorder. Getting into therapy, getting in and doing some CBT can really help with that. One study found that CBT was more effective than light therapy at treating people with this. And then sometimes it might take some medication. So once again, really encouraging folks to reach out to their medical provider for help and support around that. So here's some other tips on how to really beat the winter blues and or when seasonal affect disorder is making sure we get, great amounts of sleep, making sure we're having good sleep hygiene, as she stated. So going to sleep and waking up at the same times every day, even on the weekend, making sure we're having a healthy diet and really getting our bodies moving, spending time with families and friends. That social connection piece is so important that we can be encouraging of our families to do. And really when on these sunny days, like I feel like we're having today, really get the blinds open and really getting that sunlight into our homes. Here's a video we're going to watch now about from Psych Hub about depressed moods.
I don't remember what it's like to be happy.
I want to laugh, like everyone else.
I smile on the outside, but that's not how I feel inside.
Sometimes I get really irritated and angry at the people I love.
These are the voices of depressed mood. The people who live with this symptom battle to find brightness and joy in their lives. I know. One of those voices is mine. Sadness is a part of life. Some days we feel blue, down, and depressed. This is normal, and everyone experiences it from time to time. In fact, a good cry is sometimes the best thing for us. There is a point, though, when sad feelings don't recover on their own. They stay, and they get worse. And they begin to affect everything else in our lives, too. When I was depressed, I didn't cry very much, like some people do. In fact, most people couldn't tell I was depressed because I was trying so hard to look happy. I always tried to be there for others, and I told people I was fine. Then I found myself snapping and being irritable around my family. I didn't want to push them away, but I know I did. Eventually, I just felt so down I couldn't pull myself out of it. I felt that no one understood me, and I felt guilty for getting mad, and that made my mood even worse. For some people, depressed mood comes with hopelessness. This means the future is part of that negative thinking, and you can't picture a good outcome, or any outcome at all. Hopelessness can be really scary, and can be directly related to suicidal thoughts. If this happens, it's an emergency, and it's the most important time to reach out and connect with someone who can help. Don't go it alone. Call a friend or someone in your family, or call the National Suicide Prevention Lifeline. There are several mental health diagnoses associated with depressed mood. Evidence-based treatments are effective and can help with any of them. If you or someone you care about has depressed mood that isn't getting better, and especially if it's getting worse, talk to your healthcare provider or mental health care professional. Your mood can get better, and you can feel happiness again. I sought treatment. My provider recommended therapy and medication. For me, the combination worked. I'm smiling on the inside now, too.
All right. So we share that video to share that it isn't so obvious all the time that someone is in a depressive mood and or having suicidal thoughts. It may not be something that they are overtly discussing and talking about with their family, their friends, etc. So it is important for us to perhaps be just mindful of the potential signs, and we're going to talk a little bit about how the depressive thoughts can potentially lead into suicidal ideation and what we can do to just raise our awareness and think about prevention initiatives. So a little bit about Indiana statistics is on average, one person has died by suicide every hours in the state. Keep in mind that these statistics are a little dated because the research is always slightly behind what is currently happening. But something else to keep in mind is Indiana's suicide rate has been higher than the national suicide rate since 2000. It is the second leading cause of death for Hoosiers between the ages of 10 and 34, and suicide is the 11th leading cause of death in Indiana. In 2021, the Indiana Department of Health did conduct and publish a survey of over 1,000 teens from across the state. And these are some of the startling statistics from that survey. So we saw a bit of a jump from 2003 to 2021 in the consideration of suicide. And then actually moving to that actual plan, we saw another significant jump from 2003 to 2021. Some other statistics that came out of that youth risk behavior survey that does get conducted every so many years in conjunction with the CDC is seriously considered attempting suicide versus the national average. You see that we're a bit higher there. Made a plan, we're a bit higher there as well. Actually made an attempt, we're slightly higher than the national average as well. So something to be thinking about as it relates to our youth is we want to be mindful of suicide prevention and awareness. 46% 46% of people who die from suicide had a known mental health condition. There are other factors that also may put someone at risk as well. So, if there's a family history, if there's a history of substance use or intoxication, access to firearms or other weapons, a serious or chronic medical illness. Although more women than men attempt suicide, men are 4 times more likely to die from suicide. A history of trauma or abuse, prolonged stress, and a recent tragedy or loss. It's important for us to know what suicidal ideations are. So those are comments or thoughts about suicide, and those can even begin small. For example, if someone is saying things like, I wish I wasn't here, nothing matters, over time it can become more and more explicit and dangerous too. So some of the additional warning signs are increased substance use. And we see a lot more aggressive behavior. If we're seeing a lot of social isolation and withdrawal from family and friends, reckless behavior, if we start to notice that they're doing things like buying weapons, giving away all their belongings, saying goodbye, those are all things that should raise some concerns. So, how can someone provide support? We might be caught off guard or unsure of how to respond, but here are some ways to approach a suicide related crisis. We want to talk openly and honestly, and don't be afraid to ask questions like, do you have a plan? This can really help us gauge their suicidal ideation and kind of help us gauge the risk scale. We can do some safety planning around that and encouraging the families we serve, if they have someone in the home that's having these, have help them work through these kinds of safety plans. Asking if they have a mental health provider and can we get in touch with them about that as well. Remembering our mandated reporting requirements, I think, is an important thing too. We want to stay very calm, very neutral toned with our voice. We don't want to threaten or argue. We don't want to debate with them. We want to be very patient. We also want to know that we may be the only one who has this information. We may be the only one who, if not me, then who, is the way I like to think about it. So, from the American Suicide Prevention Association, these are some great tools and tips from them in the next few slides. Assume that we're the only one who will reach out. If we're concerned about someone, talk to them in private. Let them know we care. Talk directly about it and calmly without judgment. Show understanding and take concerns seriously. Let them know that their life matters to us. And that's this one conversation could save a life. So talking is the first step to preventing suicide. Be direct. If you suspect someone is thinking about suicide, let them know you're willing to talk and that you're listening. Show your support and connect them to resources. If someone seems to be experiencing significant emotional pain, here is some other tips. We can ask direct questions. We can keep them safe through those safety planning. We can be there for them, connect them to the 988 crisis line, and definitely stay in touch. So we want to make sure you know the difference between the different helplines that are out there, and you can be educating families in our community about this too. So I love this infographic that says make the right call. Maybe we can look at getting copies of this and posting these in the safety stores and just for you to have these on hand. But of course we know that 988 is our suicide and crisis line. 911 is for when life or property is threatened, and it has a long list of these examples: house fires, medical emergency, robbery, domestic violence, so on and so forth. 211 is information and resources, and there's the poison control there as well. Here in Indiana, we have our Be Well crisis helpline. We have our warm lines that are limited support, chat, and those are connected to 211. And then so this is another helpful chart as well that shows you the difference between the different levels of help and support. So that whole notion, let me go back, of that very last, that green area, that might be a new term for you, a warm line. So how would a warm line support? Well, it's peer support or peer operated behavioral health warm lines. They provide empathetic listening and peer support. and can offer confidential, non-judgmental space for connection and self-directed exploration of possible solutions and alternatives. It might be someone with lived experience who identifies with the concerns. They are a judgment-free space and can help folks talk through difficult and emotional experiences and connect to resources. We know that talking helps, and research has shown that people feel less distressed and more empowered after they've talked to someone at a warm line. So something to really be mindful of is that what warm lines are available. So warmline.org is a way to find out those in our area. And then the NAMI, which is a National Alliance for Mental Illness, the national helpline there also has a directory as well. So when we're thinking about this, there are so many great, phenomenal resources available both locally and nationally that we can be telling our families and our community about as it relates to this important topic. So this is a great slide that really just gives you a snapshot of what those are, whether it is the QPR training. If you have not yet attended a QPR training, they're really great about, it's a prevention initiative, question, persuade, refer. I believe that's what it stands for. We have the Trevor Project. Locally, we have the Indiana Center for Prevention of Youth Abuse and Suicide. NAMI has great resources too, Mental Health America of Indiana, the VA, so on and so forth. All of these are fantastic groups doing fantastic prevention work on this topic. We also have just a phenomenal amount of resources. One I did not include on the previous slide, but it is in our newsletter, is this link right here. And if I click on it, I don't know if it'll pop up, but it is the American Foundation for Suicide Prevention. We do have an Indiana-based office or chapter. And so definitely check out that website. They have a great amount of fantastic resources and things like that. Many of those that I showed you on the previous slide also are listed here as well as part of our resources. So that really concludes our topic for this month. Be sure to check out the bulletin board in your office. Be sure to also check out the newsletter. That topics. Do not hesitate to reach out for additional help and support. Thank you so much for tuning in this month. We'll see you next time.